What led to the surgery was we'd have to go back to the time I was at college, and I broke my leg quite badly then, but it was fixed, and life continued perfectly well. I ran marathons and did lots of sport and led a perfectly normal life until around my late 50s, when I realised or noticed that I was getting pain in my right ankle, and that didn't go away, and whatever I did, it was kind of getting worse. So after a while, I went to see an ankle specialist, and after a scan, I was shown to have osteoarthritis in my right ankle quite badly. And so it was a question of how long I could sort of cope with that until I had to do some sort of surgical intervention to sort it out. It was getting to the stage where I was no longer enjoying the things that I used to enjoy doing because I was going to be in constant pain. And it affected life just in ordinary ways. If I was sitting down, if I got up from sitting down now, I would be in real pain, just sort of kind of got over that initial movement of the ankle. So yes, it was certainly getting me down increasingly.
My name is Ali Abbasian. I'm a consultant orthopedic foot and ankle surgeon. I've been practicing foot and ankle surgery at consultant level now for over 12 years, based in central London. I have been doing ankle replacements now for over 8 or 9 years, and I've been using this prosthesis, the Infinity, for that time. So partly because of the instrumentation, I would say, the ease of implantation and the accuracy. So before we started using the prophecy component, which basically allows patient-specific guides, the Infinity implant had a very good instrumentation in terms of X-ray guidance. And since then, with the patient-specific instrumentation, it makes placing the accuracy of placement very good. And also the early results, I know this is still a relatively new implant, but it's now been around for 10 years. And the end results have been very good. I've been using it for 8 years and I've had an excellent outcome with my patients. So Tim consulted me. Initially he was referred to me by one of my colleagues who had discussed with him the options of ankle fusion or ankle replacement, and he was sent to me to consider a total ankle replacement. Tim was very active. He played golf and he wanted to remain active, and that was one of his concerns, and he was very keen to maintain that range of motion that he had in his ankle. The other issue with him was that he had some arthritis elsewhere in the foot, and we know if you have an ankle replaced, you can put additional strain on those joints and you risk causing arthritis in the neighbouring joints. So that, together with the fact that he wanted to maintain his range of motion, made us consider a ankle replacement over a fusion. Ankle replacement surgery is quite a big operation. There's a big incision, so you would expect some pain afterwards. This day and age, we have good sort of anaesthetic techniques where we essentially block the nerves that supply the foot whilst the general anaesthetic is in place. So generally the patients wake up very comfortable because the leg is numb from the anaesthetic. That lasts for the majority of the first post-operative day, which the pain is at its worst. After that, the main pain management would be with oral painkillers and with elevation, and the majority of the patients manage very well. So in Tim's case, he had a bit of a deformity in that his foot was turning in a little bit. We call that varus. And obviously it's very important that when you do the ankle replacement you correct that, because if you leave the ankle replacement slightly tilted, then what will mean that over time, the same way the native ankle failed, the ankle replacement can also fail early. So it's very important that we make this correction. Some of this correction is done by doing the soft tissues, but some of it is done by making the cuts along the bone in exactly the right position. And what's very helpful these days is that we can match the patient's anatomy to the instruments that we have through computer-guided instruments. So we can get a three-dimensional scan of the patient's ankle, and we can then make molds and specific instrumentation for those. And this is something that's really revolutionized how we can do ankle replacements very accurately.
I was pleased with the speed that things did improve. But obviously you had to have some patience, there was some pain, because the ankle had been so kind of traumatized through going through all the operation. That was bound to kind of mean that there was, you had to get all the muscles and the tendons and ligaments working again. But equally, I saw sort of week on week, I could see significant progress. So within about 6-8 weeks, I was up to 10,000 steps again and started to venture out to the golf course. And I'm now walking 20,000 steps on some days. And I sort of noticed it very much just last week. I was up in Scotland and we have this coastal walk that we do. We've done it for many, many years. And last year, before the surgery, I got to the stage where I couldn't face the idea of going across the rocky ground and the stones because that was too painful. Last week, I did the walk, 2.5 hours, no pain whatsoever. And it was kind of joyous to be able to enjoy this lovely walk. I've met a lot of people who kind of are quite surprised when they hear, I've had an ankle replacement. That's really difficult. Everyone hears about hips and knees are quite common, but ankles are obviously supposedly much more difficult. I expect that's right. But I would say don't fear it in the way that kind of my experience has been only positive.